Hi, I'm Dr. Patti Farris. I'm a board-certified dermatologist, and I'm your host for this episode of Skincare Confidential. Just as a reminder, and I know that most of you know this at this point, but Skincare Confidential is an extension of our medical meeting, the Science of Skincare Summit, which is going to be held September the 5th through the 7th. We're going to be in Austin, Texas again this year at the Fairmont Hotel, which we moved into last year, and it was a great venue. So if you're interested in taking a deeper dive in any of the subjects on the Skincare Confidential podcast, check us out at scienceofskincaresummit.com. Registration's now open. So today I'm super excited because my good friend Ellen Gendler and I have been trying to schedule this podcast for 6 months. And here we are. Woo, we got it done. And it's really great when you have good friends on. First of all, I learned so much from my friends and about my friends. So I'm going to start with Ellen's bio. And there's a lot of stuff in here I didn't know, Ellen. I know you're very accomplished. You have a huge practice in New York City. You're a board-certified dermatologist. You're a leading authority in cosmetic dermatology and also in topical skincare. You have been voted many, many times as one of the best doctors in New York Magazine. I know that's a coveted list by you New York doctors. And you're also most known, I think, for your interest in injectables, neurotoxins, and fillers. And you've been a trainer as long as we've known each other, which is a very long time. You're also a clinical associate professor at NYU Longden Medical Center. You continue to teach there, which is wonderful. And you served as the co-director of the contact dermatitis division for many years there. That I did not know. I did know that it's very interesting. Mm-hmm. I did know that you were the director of the Cosmetic Symposium for at least a decade. And my first talk at the American Academy of Dermatology was when you invited me to talk about retinols. And I remember you looked at me and you said, "Do you think it works?" And I said, "That's the title. Retinol, does it work?" And that was the first talk I ever gave. I loved it. It was so much fun. But anyway, the rest is history on that. Something that's not in your bio that I do want to mention is you have garnered a very large social media presence, especially on Instagram. And one of the things that you, I think, are known for is your sort of no-nonsense approach. I always say, I love it when you say, "Are you kidding me?" You know? And you make me laugh every day. So if you guys want to have a wonderful time and learn a lot about what works and what doesn't work, follow Dr. Ellen Gendler. And that sort of brings us to the subject today that we're going to talk about, because something that you have talked about on social that I think has really propelled it into popularity is topical estrogens. And you were into this long before anybody else was into it. So I want you to start by telling me, how in the world did you get interested in topical estrogens?
Well, let me just introduce one little thing about my contact dermatitis history, which you probably will find interesting. Back in the day, that's what I did. And I did extra training in London with Etienne Cronin.
Oh, I saw that at St. John's.
Yeah. And I co-directed the contact derm clinic at NYU for years. And that was the era before any of this. There were no cosmeceuticals, or there were very few. But then as they began to develop, we started to see reactions. So we would be testing people. And as a result of that, I got to know about all the cosmeceuticals that were around. That led me into fillers, so that I was the principal investigator for the first HA filler that went on. And that's how my whole thing started. But the world of cosmeceuticals and cosmetics is a completely different world than when you and I began this whole journey, as you know.
Oh my gosh. Are you kidding me?
So it was kind of crazy. And there really was very little. I mean, retinoids were the first thing. They're probably going to be the last thing too, right? But but the way that estrogen came to me was kind of a weird story. I had this elderly socialite New York City patient, and she was like spectacular looking. And you know, we didn't really have things to do. Then I said, "Your skin is amazing." And she looked at me and said, what do you do? And she said to me, "Well, I use my estrogen cream on my face." And I thought, what? I mean, that was even before the WHI study had its heyday or its nayday.
Screwed everything up.
Right, it screwed everything up. But
perfect.
Nayday, right? But it was really interesting, and I think I was probably 40 at the time, maybe something like that. And I had this idea in my head, and I thought to myself, you know something? What if I'm not going to smear it all over my face? But what if I got some? I'm going to try using it around my eyes, because that seemed to me to be a really good place to test it out and see how it did. And I'll tell you, I mean, I've never had surgery on my eyes. And until I started using lash serums and dissolved all the fat around my eyes, it was really amazing to me how my eyes look now. was that a controlled trial? It wasn't.
No.
But it led me into a whole, rabbit hole of learning about how estrogen topical treatments became a thing. And, I'm sure you know a lot about this too. Back in the day in the 40s and maybe even the 30s, the cosmetics companies were using vaginal estrogen to smear on women's faces. And they had those crazy commercials about only your husband will love you more and all those things. And your skin looks so smooth. And this went on for a long time before, I think, maybe the 1940s, when the FDA came down and said, we don't have any studies on this. We don't know what this is. Before we're going to allow this in cosmetics, you need to, studies need to be done. Well, once that happened, there wasn't anybody going to do this. Correct. Yeah. It kind of went away. And then the WHI study came, and that was goodbye for everything like this. So that's really how this topical estrogen thing hit.
It's so interesting. I really didn't know that, but so you have a lot of experience though, because you adopted that into your practice.
I did. And I've been giving it to my women patients. Now, remember, I'm talking about using it around the eyes. Right. I never advocated for anyone to use this all over their body. Never.
I had little it everywhere now all these compounding companies are selling it, estrogen. Talk about, so everybody understands, what are the benefits of using estrogen? What does estrogen do? We talk about estrogen deficient skin, which all of us at our age have.
Right. Starting in perimenopause, we're become estrogen deficient. And there are very, very solid studies to show what a lack of estrogen does to the skin. It makes the skin less thick. It makes it more dry. It diminishes your sebum. It makes it less elastic. It makes it heal slower. It does anything you don't want is what estrogen decline does. It does everything bad. Okay. So, it stands to reason that replacing estrogen might be helpful. Now, I never say that taking systemic menopausal hormone therapy is to be done for the skin. And the studies are not all that impressive in women who take menopausal hormone therapy, in the past called HRT, that whether there's really significant differences between those women and those who don't in terms of their skin. But there seems to be a benefit to using topical estrogen on limited areas of the skin. And we can get into it. And I would love to know how you feel about this as we start talking about it, because there are a lot of naysayers. Most of the naysayers appear to be the derm influencers, shall we say, who are 30 years old, some of whom have never practiced, but they really don't have a patient base, in my opinion, that would lend itself to seeing how people do over the course of a decade. I mean, you and I know what women look like as we get older. Yeah. We start out gorgeous when we're 30, and then we end up like us now, Exactly. So if things you can do to stem that, it may be reasonable, but we could talk about this forever. So
I think the big issues on estrogen are the systemic absorption issue. And I know you're well versed in it. So let's talk about that, because that's one of the reasons people throw this under the bus.
Right.
It's going to get absorbed.
Okay. So let's talk about that. There have been countless studies and reports saying that it doesn't get absorbed when used in the doses that we're talking about. Okay. And so there's this endless studies, and even with vaginal estrogen, vaginal estrogen is used in women with breast cancer. And there are studies to show that when you use vaginal estrogen, if you insert it in the outer third of the vagina, it's absorbed even less than when you do it on the inner third of the vagina. So there's so many safety studies on this, so many. And so I feel like I get it. I understand why people worry, because it's not a real controlled environment. When you tell a woman to, put estrogen cream on her skin, how much is she going to use? And there need to be safeguards put in place. But there are a few reports, and everyone talks about the same reports. And I really want to address those before we get into the good things about it. And there was really one report that got a lot of attention. And now there's even a second report, and both of them are bad reports. Let me tell you, there was a report by Komori, I believe it was 2009, maybe it was 2008. And it was, get ready for this one. Hold on to your hat here. It was a 93-year-old woman, 93, who had been using a topical estrogen cream, ethinyl estradiol cream. I don't even know what that is, but using that, you're ready for this, 3 times a day on her face and entire body for 45 years. And at 93, she developed breast cancer. And so that's considered a report of a
anyway.
Okay, that's considered whether she would or she wouldn't.
Case report.
Okay, I said so, but there's one case report, and I just recently was made aware of another one. This one was a killer too. You ready for this? It was I forgot what year this was. Forgive me, but it doesn't really matter. It was like a 3-year-old or 36, like a 3-year-old girl whose mother used hormone-containing hair lotions, and the girl slept with her mother and cuddled with her mother and played with her mother's hair all the time. Then when she was done playing with the mother's hair, she would play with the empty bottles, and then she would play with the mom's combs. And she started having some vaginal bleeding, got tested, and she had a hyperestrogenic syndrome. Yeah. And this is considered another piece of evidence that it's dangerous. Now, come on. And they tested in that situation, they ended up testing the mom and the daughter, and they had high levels of estrogen. But, let's be reasonable. These don't matter. These are not appropriate.
Well,
so let's not think about it. They're case reports, and they're silly. Okay, because that's not what we're advocating.
I don't make too much of that.
The first woman, the 93-year-old, do you understand how much she was using? Let me describe. I'm trying to see if I can. Let me pull up a tube of some rando cream. This is an amount, okay? This is what's considered a fingertip, okay, amount of cream. That's 0.4 grams. Now, that is so much that if I tried to smear this all over my face and hands, it's tons. So she was using the equivalent of like 3 tubes a day of a 30-gram tube. It's insane.
Well,
so
let me ask you a question.
Worry.
Yeah, those case reports, again.
This is hand cream, so don't think it's estrogen.
I'm just curious. Can you use a topical estrogen when you're on HRT?
You can. Okay. Absolutely. Number one, women on HRT are using vaginal estrogen. And there have been quite a few studies that have shown, that looked into, comparing women on HRT who use topical estrogen and those who didn't, and comparing the skin, the skin benefits of topical estrogen in both groups. What? And the ones who use topical in addition to systemic had better results.
What are the differences in the types of estrogen that you use? Well, topically.
Okay, so here are the right. Estriol. So let's talk about the kinds of estrogens that there are. There's estradiol, there's estriol, and there's estrone. Right. And they're at different times in your life. Estradiol is at a different point. Estrone is the hormone that's found when you're pregnant, and estriol is a weaker one. Estrone is the weakest, then estriol, then estradiol. So most vaginal creams are estradiol in the prescription world. There are other topical estrogens, as you know. There's Premarin cream, which is conjugated equine estrogens. We could talk about that as well. And that's not estradiol, and no one actually knows what it is, but it's a mixture of different estrogens. And then there are other formulations. There's transdermal, there's patches, there's sprays, there's gels, all other ways of delivering estrogen in different doses. But those delivery systems are for systemic hormone therapy. They're different from the doses we're talking about in topical. So when we say topical, I don't mean your patch that you put on or your gel that you spray on your arm as your systemic hormone. I'm talking about vaginal estrogen doses. That's generally estradiol 0.01%. However, in Europe, they don't use estradiol for whatever reason. I don't know the reason. And I think maybe in Asia, same thing. They use estriol, 0.03%, and that's what's approved for vaginal use. And many of the companies now that are compounding topical estrogen are using estriol. Right. Which is a weaker estrogen than estradiol. Right.
Wasn't there a study comparing the two?
There's been many studies comparing them.
But topically for skin, that's what I thought.
And there was a recent one that was done by one of the companies that makes a compounded version called Alloy, and they found that both estriol and estradiol had benefits to the skin that were very similar Neither one had systemic absorption of any significance. And so that was an interesting report. Now, was it in a peer-reviewed journal? Not yet, but it probably is going to be.
They should publish it if they did a decent study.
Exactly. It was a really decent study, and it was a reasonable amount of time. 12 weeks. So, they showed their endpoints were met. Now, nobody is saying that this is a home run miracle. No one is claiming that. So let's just get that out of the way. This is not going to transform.
I think there are probably some people saying that.
There probably are some people, but they're wrong. That's not. This is like an adjunct to all the other things that we use in skincare, and better than anyone. Most of the things that we use are the benefits are modest at best, other than things that we are, sure of, like retinoids and things like that. And topical estrogen is in no way meant to substitute for retinoids. When people say
totally different mechanism of action.
Totally different.
But, retinoids boost collagen in a different way than estrogen.
Right. And we don't even know. Right. And we also don't know how estrogen boosts collagen. There's so many things about estrogen that are interesting, fascinating, that we don't know. So I'll tell you a couple of things that fascinate me. Number one, we have estrogen receptors all over our body. Every organ has them. And there's alpha and beta receptors. Mm-hmm. Okay. So the beta receptors are more prevalent in the skin. Alpha receptors are the ones that you worry about when you talk about reproductive cancers. Okay. So that's an interesting point, because when the skin is stimulated, it's most likely not stimulating the same locus as what's needed to provoke or prolong or worsen endometrial or breast cancer. So that's important.
So they're hitting different receptors, is what
Correct.
You're saying. Okay.
As far as we know, that's true. The other thing that's interesting, and this I find really fascinating, there are some studies that showed that estrogen antagonists seem to do some of the same things that the topical estrogen does, so that some people posit a possible mechanism that we just don't know, that maybe that topical estrogen activates something else that helps the skin. It still is unclear. And a lot of the studies are done in vitro. You know this as well as I, that they're difficult to try to prove something when you're doing something in vitro, because it doesn't always translate into in vivo.
No, of course not. Of course not. So talk about some of the studies. I know you've reviewed them all. I know Zoe Dralos did one. Some of the studies that really substantiate the benefits.
There are so many. Now, some of them are small studies. Some of them are pilot studies. Some of them are observational studies. But some of them are placebo-controlled, double-blinded. There are so many. And they go back really into the 1990s, which interested me because I didn't realize anybody was even looking at this back then. But they started, Phillips and Hall started way back in the late 90s looking at estrogen deficient skin, and then having the concept that maybe you could replace estrogen topically and see whether or not it was helpful. So there have been many, many studies. Virtually all of them have shown some degree of improvement in all the parameters that we're looking at. The skin became thicker, the pores became smaller, there might have been a little increase in sebum production, the skin became more elastic, maybe some lines look better. Now, there were some studies that didn't show a big difference, in how the wrinkles appeared. And all of this, in my opinion, while yes, estrogen is technically a drug, this almost falls into the cosmeceutical arena in the sense that when we gauge what cosmetics do to our skin, Patti, tell me if you disagree, many of the results are subjective. So a woman could say, I love my skin with this. And we could measure everything possible and show no difference, but the woman thinks she looks better. Well, most of these studies had observational studies where someone else said it looked better. So we're not reinventing the wheel.
The investigator was looking
exactly.
at the changes?
Correct. And in some of the
gauge than what the subject thinks. The subject always thinks it works because you gave him a free tube of cream.
That's right. But there were some studies where the subjects didn't think it helped and the observers did think it helped. So, we're not talking about causing a facelift to happen. We're talking about improvement in the quality of the skin.
It's always good when the subject self-assessment and the physician or the investigator self-assessment parallel.
Correct. Totally.
That's always good. You don't want to see one go one way and one go the other.
Right. But, the things that they look at skin thickness and they use as so many studies. And I know it's difficult when I'm not citing individual studies, but there are countless studies. That's what I'm telling you. And there were only a few, like a handful, that didn't show improvement in these parameters. And so I decided, let me just look at these studies and see what were they. There was one study from Korea that used estrogen cream around the eyes on the crow's feet, and they saw no improvement in lines. Well, why would you expect to see improvement in lines? We know that the only thing
you need neurotoxin.
Exactly, you need neurotoxin. So that was a dumb thing to look at, or you need retinoids to do something. So then there's some that looked at changes in pigmentation. Well, why should this improve your pigment? There's no reason for it to improve your pigment.
Exactly.
Fact, right.
So this is sort of the way I see it. And I was going to start here, but I wanted to jump into estrogen. This is a treatment for intrinsically aged skin. I've put this in the category of this is intrinsic aging. This is the aging that happens as a result of birthdays. It's not because of the sun. It's not for brown spots. It's not for the clinical stigmata of photoaging or what we call extrinsic aging, which is actually a way more caused by many more things than just UV, as we know now, the whole exposome. But this is something for intrinsic aging. So has somebody studied it? And I know somebody must have.
Lots.
Like
they did.
Crepiness. Like this is how many women come into your office and go, "Oh my God, will you fix this? I'm begging you to fix
1 million a day.
1 million a day."
But here's the problem. Here's the conundrum.
It should help crepiness.
Well, but what does that mean?
Aging.
Wait, let's talk about it should help. To me, I don't think of topical estrogen as something to reverse what's already there.
I think it's more of a prevention.
That's how I look at it, because you have your arm and, you see this. Don't look at my blood test.
But I'm the same thing.
How is
why we have long
estrogen?
sleeves on.
Right. But no, I'm doing it because look at my husband drew my blood and nearly killed me.
Oh my gosh.
But I mean, do you expect a topical cream to reverse this? No. So I view it as something that you do this for the long haul. And this is where it's fascinating to me. So many of the things we use in dermatology are to see results that you can actually visualize, like treating pigmentation with hydroquinone or with lasers. You have brown pigment or brown spots and you get rid of them. They are one day, gone the next, right? Or
laser, yes.
Retinoids. You see your face is all mottled and scaly, and you use retinoids and then your skin is smooth as silk. Those are visible changes you can see. What we're trying to help with estrogen topically is to help prevent the signs of intrinsic aging. We're never going to stop it completely, but if you can help it, that's a boon. However, there's been many studies about, looking at this on sun protected versus photo damaged skin. And the results with topical estrogen are in protected skin. It doesn't appear to do the same thing for photo aged skin. So
I know. Aren't those studies super interesting? I know Voorhees published one years ago.
Several people did. Ringcat published one. There's right.
So interesting.
Think about that.
I think we have to put it in the right place for people who are listening to understand this isn't your brown spot treatment. This isn't to treat clinically damaged skin. It's
now,
not a retinoid.
I hate to be one of those interrupters, but I'm going to be an interrupter here. This is how I got to my concept of using it around the eyes, because women come in, the first thing they complain about is their eyes. The first thing. You see on social media that women are getting.
What's the second thing?
They're around here. The neck, but also here. This thing, right? The neck gets worse later. I mean, you got to have a few more years on you.
We're later. We're later.
But the eyes, every 40-year-old in my office is talking about it. Okay, but now they've been getting toxins,
so maybe get your eyes done. Just go get your eyes done.
But my premise was, let me pick an area of thin skin on the face that really isn't sun damaged, because we don't really see that much sun damage, particularly around the eyes. People wear glasses, but whatever, this is where we see sun. So,
your brows really kind of protect this area.
Yeah. And
it's not, but this is where you get it, where the
correct.
prominences are.
But this is the area that's super thin. And that's where I came up with the concept for myself, to try to use it there and see if maybe I could help not have to have a blepharoplasty at the age that most people have them. And I think I succeeded. Now, this is an N of 1, but I tried it on so many people, so many women over the course of the years.
Are there eye creams being sold by these internet companies with estrogen?
Well, I think there's one that's going to create an eye cream, but what's the magic in an eye cream? You and I will always say that eye creams are BS for the most part. So to me, I always use my vaginal Premarin cream, and that's what I use under my eyes. And for whatever reason, the base is nice enough. It's not something I would have smeared all over my face, but the base is nice, and I use it as my eye cream for 25 years. That's what I've used as eye cream. I've never put another eye cream on.
Remember, I had a conversation with you after you gave the talk at our meeting, and I said, why don't you write this up? Because you probably have more experience with it than anybody. I mean, I don't know anybody else who was really doing it over a long period of time.
Right.
And I mean, it's hard to do these retrospective things, but I know you take a lot of before and after pictures, and you could probably come up with a decent cohort of patients to report.
We could, but it's really hard when you think about it. I'm going to take a picture of myself when I was 30 and then myself today. Now, the rest of my face doesn't look that great. So how are you going to judge? I haven't been using it.
But don't you use retinoids?
I do, but I'm saying
retinoids for years.
No, but my skin is beautiful. My skin is really nice, but I haven't had surgery, so my skin is loose, and that's what we would be using. Estrogen is not to get rid of brown spots, to get rid of sunspots.
It's not going to tighten your skin.
Right, it's not going to tighten. So how, if I could have done half of my face for 20 years and the other half not, maybe then, but it's really hard to do that. But as women, we are taught, and as men, that's not fair. We're told to start doing sunscreen when you're 15 so that when you're 50, you don't have a problem. And I view this as one of those situations. But the areas where we complain about crepiness, other than under the eyes, on the neck and the arms, if you start smearing estrogen cream all over your arms, then you're talking about using too much estrogen, in my opinion, because we have no way of documenting what you're getting.
We don't have any way of knowing. Now, there are some studies with peptide creams that have looked at crepiness and seen some improvement, at least, according to the studies.
I don't believe a word of them.
And I don't know about retinoids. I'm sure retinoids have been looked at in crepiness, but I can't really think of a study.
Again,
actually, maybe not.
But they have used retinoids in really good studies for photo age skin on the forearm. They have, but we're not talking about that. And
I'm talking about crepiness specifically, because it's a huge problem.
Show me the money. I want to see one study that helped crepiness in any.
I can send you one. I'll send you one. Yeah, and I believe it was Elastin that did it.
I've been using the Elastin Transform. Okay,
Transform body.
Yeah, exactly. I'm not seeing a hell of a lot. Yeah, no, but I use it anyway. It's not, Patti. It's not going to reverse my crepiness. I'm hoping that it helps prevent it from getting worse. I'm not looking to change it, because I know that's not going to happen. But the other thing I started to do, and let me just digress for a second in the estrogen world. So there's topical estrogen creams, estradiol, estriol. Now, there are some SERMs, SERMs, which is selective estrogen. Yeah.
Receptors.
Exactly. Selective estrogen receptor modulators. And those are interesting compounds that are not estrogens, but they somehow work to act on the estrogen receptor, but in a different way. They're called SERMs.
What are the common ones? Soy, right?
Soy, genistein, and now
resveratrol is a phytoestrogen.
Sort of, yeah. And then there's another one, and there are some that are in studies for systemic cancers. I think one's called Liquitrol, one's called Equal. Like these are systemic things they're studying. But then there's that other topical cosmeceutical that's called
MEP.
Yeah. So it's MEP. Methyl, right. Methyl estradiol propanoate, I think it's called. And
propanoids, right.
Yeah, right. And it's not a very powerful thing. The studies on it are not great. I think it was 12 or 14 weeks, a very small number of patients. It was unclear where they came from, exactly what they did, and they saw some improvement, but we don't really know what we do know, it does not increase your systemic estrogen levels.
That's what I really think the studies were for, to make sure that it didn't cause any.
But what I've started to do, because we know it has no effect whatsoever on systemic estrogen levels. So I'm never going to be smearing my Premarin cream all over my arms.
Right.
But what I started to do,
MEP.
I do. That's what I've been doing on my forearms and my arms. And let's see how it goes. I'm doing it on one arm. I've been doing it maybe for a year, and I'm going to see if there's any difference in another year. I think that's a reasonable suggestion. I personally think if you're going to do it, do it. So either if you want to try using estrogen around your eyes and you want to put a tiny dab on the tops of your hands, which is another place, that happens, that's how I recommend it.
So if you're on a desert island and you could pick one cosmeceutical to have, what would it be?
It would be retinoids.
Retinoids.
Yeah. You too.
I think we all have the most confidence in retinoids. They've been studied for so long.
And the proof's
still
in the
gold
pudding.
Standard.
But you have patients that you've given retinoids
for
for 20 years, and they walk in and they're 80 years old and their skin's gorgeous. So you just see it. That's what
if they stay out of the sun and they
right.
use the retinoid.
Right. So the people who are naysayers and they look for negatives, and I don't blame them, because this is an important subject to look for, problems with. But remember, so many of the things that we use in medicine are used, quote, off label. So if something's approved by the FDA and you might notice something that happens, or you might have an interesting thought and use it and see if it helps. Case in point with hair growth, minoxidil. Oral minoxidil, right. Bimatoprost. Remember back in the day,
yes.
I still remember my first AIDS patient who had CMV retinitis, and they would use the Lumigan drops for their eye. And I had a series of pictures with my AIDS patients had eyelashes that came out to here hitting. And so we learned. And so that's how that developed.
We sure did.
Right.
We learned, and then we had to unlearn, because all of that fat atrophy that happened.
Oh my God! When that killed me. That was really bad.
And that's unfortunately not something that you can go back on.
But there are lots of naysayers about this, and on social media, anytime something comes up, right, there's going to be people who talk about it and try to make money from it. And there are going to be people who try to put it down, particularly if they can't make money from it, which is really annoying. So what's the reason not to do it, not to use topical estrogens if you're a woman? If you're on social media. It just
depends. I mean, if it's just your eyes you want to deal with, it's right. Reasonable. I mean, I would say it's an eye cream at that point. Correct. If you don't feel comfortable using it all over the face, it's just an eye cream. But let me use just say use something else.
The thing is that when those who say don't use it, and they cite these concerns, the two I mentioned before about breast cancer and whatever, or this little baby who ate her mother's hair lotion. But the other one is the exacerbation of melasma.
There's got to be large cohorts of patients that we can look at who use topical estrogens vaginal, and the vaginal mucosa is more absorbent than the skin.
It is.
Stratum corneum is a better barrier than the mucosa.
But what also was interesting with that is they found that the levels of absorption when you first started to use vaginal estrogen were higher at the beginning than they were after several weeks, when the vaginal epithelium thickened, which is what it's intended to do vaginally by using it. So I think that also may stand to reason with our skin. But there's the negative things you hear now are, one of the big ones is it causes or exacerbates melasma. Now, you and I know.
There's a case report. That's all I've known.
There's one case report. But when you listen to some of these people who talk about, many people report it. I don't know. Do we know if people actually have melasma? The case report that everybody cites is melasma on the arm. Okay. And it was with a transdermal estrogen, and it was on a woman in Florida, and we have no idea what this woman did as far as sunscreen. So it's not a good case report.
I think we could say that about most case reports. Reports are case reports. They're not
studies.
But
they keep citing it, and they talk, and then people
cite. You can cite case reports, but it's not a study. I mean,
that's true, but that should not necessarily deter people from it. What I tell my patients is, if you have a history of melasma, then maybe you should use topical estrogen with caution, because we know that it can it spurs the production of melanin, estrogen itself. Whether it does it.
One thing I'm going to say, and then this is totally on a different subject, but it brings me to this. One thing that is very trendy is clean beauty. And one thing these I know you and I feel the same, but one thing that clean beauty enthusiasts are all up in arms of is endocrine disruptors. I mean, but and look at the sunscreens, what they've done and how they vilified chemical sunscreens that we all know have been used for so long and we believe they're safe.
Right.
But they vilified them because of endocrine disrupting. So I think that the world has to turn 180 before it would be really accepted that using something that's that endocrinologically active.
Well, I don't know about that because there is a proliferation of online women's
I'm sure
health.
People are using it like crazy.
Yes, and there's so many companies that are
crazy.
Yeah, so I don't think that's. I think there's going to be a group of people who are not going to use it. There's always going to be a group
of people who will do it. Absolutely.
But the online companies that are dispensing women's health now, they do menopausal hormone therapy, systemic, because there is a lack of access, and the WHI really ruined it for many women because we were not given an opportunity to take hormone therapy, thinking everything bad would happen. But a lot of these companies are now coming out with their own topical versions, and only one company that I know of has actually studied it. That's what we talked about, Myaloy. Right. And they did a very well-designed study for 12 weeks with someone very reputable. It has not yet been published in a peer-reviewed journal, but it was a really well-designed study.
Well, and like I said, they should study. They should publish it.
It's still compounded, and so you need to know what the compounding pharmacy is doing. And I investigated with Myaloy, and they do batch testing to make sure that you're getting what you says, because that's where you run into trouble. When the FDA regulates drugs, you know what you're getting. You're in a compounding pharmacy, you might not know what you're getting. That's really important. So you need to vet your source. And we have to hope that these companies do not randomly give you endless tubes of this stuff. Apparently, when you go on to register, you need a doctor or a nurse practitioner, provider.
Well, yeah, of course. These are prescriptions.
They're prescriptions. So you have to get that. But I'm worried that is there some way of getting around it, and they send you more, you register with 2 names, but apparently that's not possible because you need to set driver's license and IDs before you can get prescriptions. So there are precautions in place.
Yeah,
I
hope. Don't know how.
Yeah,
I don't think advocate anybody buys anything or with doc in the boxes on their internet.
Right. Well, but there's a lot of prescriptions that are being sold like this, and they're prescribing, FDA approved drugs. They give FDA approved hormone treatments. You can get Viagra online. You can get Retinea. You can get all these things online.
I know you can. I've got a wrap because we are so over, but it was so much fun. I knew we were going to talk. I know. I didn't even look.
I thought we had an hour.
So what's 8 minutes? No, I usually do 30 minutes.
Oh, good. Okay.
This was worthy of longer time. But anyway, thank you for joining me today. This was so much fun.
I hope
everybody enjoyed this episode of Skincare Confidential. We'll see y'all next time.